I'm Luca Boschini. I designed Blexo, BL for Boschini Luca, EXO for exodontia, extraction tools built on one principle, simplifying surgery. The magnetic mallet drives the tip forward with controlled 1.1 millimeter strokes. No irrigation, no spray, no bone removal. You preserve the alveolus, critical when you plan immediate implants. But the original extractors had a limit, not enough penetration. So you'd crank up the power, and that's when complications appear. I've seen alveolitis from this. Blexo solves it. Thin, sharp tips that separate root from bone in the periodontal space, then transfer leverage deeper, exactly where you need it on teeth with no crown left. Let me show you how each instrument works. And at this point, for example, as you can see in the video, on the left we start with our levers, doing what we can do. In terms of syndesmotomy and luxation, but often luxation is limited if we use traditional levers. Because we know that if we lever in certain spots, these thin walls easily break, and we completely lose our grip on the tooth. When the grip is lost, basically, we can't keep working this way anymore. We're forced to open a flap to access the inner system. If we don't want to do that right away, and we're using traditional levers, we have to use cutting systems. So opening this periodontal space going in with burrs, or maybe with sonic or ultrasonic instruments. And why do we need this? Because if we can remove bone in the coronal part, we can insert a traditional lever and then lever it out properly to extract it. But this, as we said, has two downsides. 1. The fact of working under irrigation, with discomfort for the patient from water in the mouth. Discomfort for us because air-water spray sprays in our face. And also the issue of visibility, which isn't minor. Now we're in the anterior, so it's still easy. But when you go to the wisdom teeth area, this poor visibility becomes a real problem. Because it's already harder to see, just due to where we're working. And from there, for example, in the past, they designed instrument shapes like periotomes that could enter this periodontal space under pressure, basically avoiding using cutting systems. With all the issues we just talked about, and so luxating, basically separating bone from root. There are many types of periotomes out there. Then with modern alloys, they invented flexible ones too. So there's everything. But there are still a bunch of issues when using periotomes. With the manual mallet, linked to the fact that, for example, we've got both hands occupied. Conversely, with the magnetic mallet, we can take this approach, but with just one instrument and one hand, which makes it much easier, because with the other hand, we can use mirrors, retractors, or cheek and lip retractors to keep things open. So basically, what we do with the magnetic mallet is a periotomy action. So cutting these fibers, inserting them inside the periodontal space, but we have a deeper advantage because many of the traditional extraction tips already designed allow, thanks to their robust shaft, to also be used as levers. So we not only get the advantage of separating bone from the root, but we also get to start using these instruments by rotating them. Leveraging, but with a much deeper application, and this makes it way easier. So I'll show you a very normal extraction. You see how thick it is. This is a traditional extractor too. Being thick gives us some advantages, but also some drawbacks. For example, here you see it can't penetrate inside the interior space. So here, using an instrument. This is one of the first prototypes of the Blexo Slim. You can get this periotomy effect that goes back to the tooth, then come back with a thicker instrument. This here is an extractor 3 instead. To lever it out and remove this root. What's the advantage I mentioned earlier? That the instrument can go deeper. Because it's pushed in and do a deeper leveraging action that lets us extract a tooth, even when there isn't much grip. At the crown level, because maybe by now it's an extremely compromised tooth. However, in this same video, as you noticed in the first images, what was happening? That traditional instruments, which are great. For the record, I use them as levers. Have the big problem of not having penetrating capability. This thickness limits the ability of these instruments to go down inside the alveolus. Obviously, this doesn't happen every time. I mean, if you can go in with traditional instruments, deep, and you can pull the teeth out, that works just fine. There's no need to move on to other instruments that are thinner, like the Blexo ones. But when, like in this case, the thick extractor doesn't have penetrating capability, this first periotomy and luxation phase, we can do it by opening our way in with a series of instruments that are what we've called Blexo Pathfinder. That type of instrument that has an action, more like a periotome than a lever. These instruments also include one from the traditional kit, the extractor 1. But honestly, even the extractor 1 in my hands has had trouble going down. That's why the idea came up to move forward with instruments that would have greater penetrating capability. Here, I'll show you what I'm talking about. This is a tooth I worked on not more than 3 days ago. Exactly because, I was prepping for the webinar and wanted to show you something new too. And I had to remove this wisdom tooth. This number 48. But it was extremely rebuilt. Had an awkward root shape. So I wanted to make it easier using the Magnetic Mallet. To do this extraction, I mounted the extractor 1 because I usually start out with the traditional kit, but the extractor 1 couldn't advance inside the periodontal space. Now you'll get to see something. See, this is the extractor 1. I rest it down. I try to push. But despite the strikes, keep in mind, I always work at setting 1. It seemed to bounce off completely inside the bone. So it wasn't thin enough to advance inside the periodontal space. So very simply, I put on a micro. We'll see it better. Look how easy it goes down. What's the problem? The problem is that sometimes the periodontal space thickness is so narrow that the traditional instrument's thickness can't have the penetrating capability to go down inside the periodontal ligament. And in these cases, it can be useful to use a thinner instrument, which is why we needed, as I said, the Pathfinder. Then you see, for example, here laterally too, where the external oblique line is. I was trying to go in with the Blexo Pathfinder. I couldn't get in. At this point, I didn't push it. I mean, a case like this is one that then also needed forceps. But, you know, in tons of cases, not in the majority, but in tons of cases, when you see that an extractor 1, which should have the ability to penetrate inside the periodontal space, doesn't have that kind of ease because the space is really narrow, you can go in with instruments that have a different feature in terms of thickness and edge, of cutting edges, to gain access to this space. Then, even if an instrument like the Blexo doesn't have it clearly means that, instead of making it easier, as I told you, that's the principle I follow, so to keep things easy, you might decide to switch paths entirely. If a tool like the Magnetic Mallet gives me an edge because I can see well, lets me work cleanly, lets me be fast, then it makes sense. If that stops happening, and it becomes stubborn insistence on using this kind of device, it likely means it's not the right device for that specific case, and you may need to go back to other tools like using traditional burrs or piezo. Honestly, I really embrace the idea that you should work comfortably as long as a product or device or material lets me work comfortably. It's perfect. But when that comfort is lost, at that point you clearly switch paths. Now let's start to understand a bit the logic behind how these tools were designed. Starting with my absolute favorite, the Blexo Micro. Honestly, it was the second tool I designed, not the first, because the first was actually the Slim. But over these 18 months of use, I realized this is the tool I can't do without. It's also one of the most delicate tools, and it's also one of the tools you need to replace more often. But it's the tool, I repeat, I couldn't do without. What features does it have? It's extremely narrow, extremely thin. But above all, it has working walls that are parallel and also sharpened. Plus, it's flat. Now I've put a first next to it. So you'll wonder what it's doing there. Actually, to be honest, this tool shares a lot with the first. Because I told you how I originally conceived the Black Ruby as a tool with greater penetration capability than traditional osteotoms. Now, the limits tied to traditional osteotoms, one of them was the taper. So what was the need that emerged? Also that of creating a tool with parallel walls so that, once the tip has perforated, only the tip is working. And once the hole is created, the walls of the hole no longer create resistance to the tool's penetration. This is how the first works. If we have a taper, once the hole has been made, as the tool penetrates further, the vertical wall keeps rubbing of the tool against the bone crest surface. Because during penetration, being tapered, it keeps rubbing all around. But if it's parallel, once the tip perforates, the crestal part stops rubbing, so the tool can glide down quickly. In the case of the first, let's say it's the initial element, the starter tool for an osteotomy prep, to give the prep its direction. And in parallel, the Micro follows exactly the same principle, meaning it's extremely sharp on the edges too. But it's the tip that does the work. Then once the tip penetrates, The walls must stop creating friction. And that's what lets it penetrate easily. Among the reasons I wanted a tool that was extremely narrow was to be able to work on roots that have a roughly circular section. And it basically works like this. We penetrate at one point. Then we shift a bit. We penetrate at another point. And so on, going all around the circular tooth surface. We create a series of small luxations, small separations, to dislodge the tooth across as much surface as possible. If we had a wide tool on a circular surface, what happens is, for example, here you see the extractor 1, which has a triangular surface. Once the tip penetrates, then afterward, as the tip moves down, the same thing we said about the first applies, and about traditional osteotomes being triangular, the sides and edges of the tool keep rubbing against the bone as the bone goes down. If the root surface is roughly flat, there will be resistance, but the entire triangular surface ideally works within the periodontal space. But if the tooth is circular and not very wide in diameter, what happens is the first few millimeters of the tip of a triangular tool work within the periodontal space. But then, as the tool descends, the side walls start rubbing against areas of solid native bone that we don't want to cut. So you get what I mean now with this white line. The tip works within the periodontal space. Then as it goes down, being triangular, the vertical part of the tool starts rubbing against areas of bone that I don't want to cut. What will these bone areas do? They'll limit the tool's penetration, creating that flaw of the tool's inability to descend and cutting into a bone area I absolutely don't want to cut. That's why a tool like the micro is particularly well suited to circular surfaces, to teeth with a roughly circular section, and it should be used all around, trying to separate, to create a periotomy effect as wide as possible. Let me show you. We'll follow this case from start to finish. One of the cases I wanted to show you today, because here I used different Blexo strategies to make the extractions easier of these few residual teeth that had to be extracted in order to do an all-on-4. Now, this is a patient. You can just barely see from the back arch. He didn't need an osteotomy. So I wanted to preserve the volume as much as possible, because the idea is to ultimately do a Toronto bridge where there might not even be a pink flange. And for this reason, since I'd also have to place implants in the anterior area, specifically in the Nabridgen 12 area, I wanted to preserve as much bone as possible. And what did I do? I started working with thin tools like the Blexo, specifically starting from tooth number 12. And since the Nabridgen 12 is a single-rooted tooth, and therefore roughly circular, it's not a perfect circle, but roughly circular, and not very wide in diameter either. Let's say this tooth is 1, where the Blexo Micro matches perfectly. And so I started, you see, going all around the surface. I had the I was helped by the fact that the crowns were no longer there. So I worked in the interproximal area too. And you see, I shift if I find resistance. I don't push at that moment, but I shift until I find zones where there's better penetration without pushing, meaning I don't add arm pressure. While I'm working with the mallet, I simply counter with my arm. The kickback of the tip, so that only the tip advances passively. I look for cleavage zones. This cleavage plane given by the periodontal space. If at one point I see there isn't significant penetration, I shift the areas where it can penetrate. If the instrument is used this way, as you're seeing inside this video, by the way, the movement is not compromised. So, once you've done this initial periotomy work, you reach the point where you need a leverage action. And as we said, we can decide to use either instruments like Extractor 2 or Extractor 3 from the traditional kit. Or if we want to be really conservative, we can move to instruments. Still Blexo, but with a thicker profile, and therefore have the ability to be used gently. So without overdoing it, even as if they were elevators, so as levers. Which instrument is used? This was the long route. The long route, basically, is a kind of Extractor 2, drawing the parallel. But just because if you're more familiar with the traditional kit, you have the ability to better relate to the shape of this instrument. And what's the difference? Compared to Extractor 2, it's thinner, always aiming for instruments with greater penetration capacity. I designed instruments as thin as possible. So this one is thin. It's sharp, razor sharp all along the edge. It has a concave inner part and a convex outer part. So basically more like or less Extractor 2. It's a type of extractor that for this reason matches very well too with circular teeth, meaning teeth that have a round circular surface. In cross-section, what's the big difference compared to Extractor 2 of the long route? The big difference is that this one can penetrate more deeply, bringing this lever deeper precisely, and while the tip is conical, it's much less conical in section. Compared to Extractor 2, we avoid having that, how to say, distortive wedging effect that could lead to fracturing the buccal wall. I said I wanted to be as conservative as possible, so avoid breaking the alveolar walls, because in some of those areas, implants had to go in. And so I went to work with this Extractor 2, which being thin, can penetrate more. Sorry, with this long root instrument, which being thinner, can penetrate further, compared to Extractor 2, and create a leverage effect that can open up and fracture the wall. Especially the buccal one. Here on the left you see this crescent moon, which is basically a long root, seen in cross-section, as you can see, thanks to this curvature. It matches great with teeth that have a surface tending to circular, but being very thin, it distracts the bone much less, reducing the fracture risk. And here you can see the extraction phase it carries, so I go more or less where it had already passed before. The micro, and you can see already that just as it went in, It already did. The minimum leverage action that allowed me to remove completely intact. The Slim. The Slim is basically a copy of Extractor 1, also with a triangular surface. But this one too is particularly thin because we want to achieve maximum penetration capacity. So it's like an Extractor 1, but it's ultra thin and sharp and it's flat. This is a type of instrument that, unlike the Blexo long root, we can't think of using as a lever, but it's only and exclusively a periotome. The fact that it has a triangular surface means that this periotome should be used exclusively against flat surfaces, because if we think of using it on a circular surface like that of the previous lateral incisor, we do nothing more than complicate things because, as we said before, then the vertical walls, which are conical, will start scraping against bone, reducing penetration capacity, and going to undermine the bone, cutting it where we don't want. This is the type of use you can do, meaning on roots that have a circumference with a flatter area. And I can think of, for example, molar roots, the mesial roots of molars, both upper and lower, tend to be somewhat flattened. So in the interproximal area, for example, it can be used, honestly, also on central incisors, because the central incisor has a shape that's tendentially triangular and therefore has 3 slightly longer sides. That's why, for example, going ahead in the case I was showing you before, I started using the Slim to work on the surface between the interproximal and palatal sides, precisely because that's an area that tends to be flat. Then, where I wanted to refine the luxation, I also used the micro. Here you see I start working that tendentially flat area of the surface between the interproximal and the palatal side. I also used it in the interproximal area too, but there, as you saw, I used it for 2 millimeters, and the tip starts bending because it starts working against the bone walls, which is what I don't want to do because I want to preserve them. The reason why to better refine this periotomy phase. In the end, I went back once again to the micro, which is super effective. Look how it goes down much more easily. Let's say where a Slim passes, surely the micro does too. It's thinner. Clearly, it takes longer. With the Slim, I have to pass it more times compared to the micro to create a periotomy around the tooth. Being much thinner makes the micro a little more bendable, so if the Slim works, it's better because the triangular surface makes it a bit more resistant to penetration stress. You saw here how easily it went down. The micro, inside the surface of the periodontal space in the interproximal area. Once the first periotomy work is done, I took the long route, going back to the same spot. I make a rotation movement because I'm pushing the tip deeper to bring the lever deeper. And then I need the rotation to luxate the element. So I go down, I shift the force application point deeper, and the moment it's down and I rotate, you see that the root starts to lift. Then basically you just grab it lightly with tweezers, and the tooth is already out. Here you also see where it peeled, where it worked. The instrument, because the periodontal ligament was almost peeled off. Same thing for the other central, you see? And I restart with a slim, because if a slim goes in, I prefer it over the micro. For what I was saying before about the fact that it's more resistant to bending. I let it work while I can. Here in the true interproximal area, I don't push too deep because I don't want to break the bone. You're watching these videos. I detached them just to remount them on the abutments. And you see, even now, the brief pause was just to change the instrument from the slim to the micro. Buccal, I really don't work it much because since the buccal surface is so thin that I prefer not to traumatize it with percussion of the instrument. I picked up a slim, and here I was pointing out the fact that if I push in this direction, the tip ends up also, let's say, cutting into the buccal surface of the bone, which is what I don't want. So I work it where? In the flatter area, toward the mesiopalatal side in this case, always based on what the surface is, the cross-section of these specific teeth. Then I pick up the Blexo long root. I can do a lever action simply by rotating the instrument, but the act of pushing it deeper in makes the lever action of the instrument much more effective. And in the end, you see a walk in the park. To remove it, there you see the whole area that was essentially planned down by the instrument. The bloodier and grainier part of the periodontal ligament, the part I needed to reach deeper, is actually the area where the instrument worked. The micro, as I was saying, is the instrument I just can't do without. And I really appreciated it. In some borderline situations, like when the apices sometimes fractured inadvertently, but it happens with apices. Why is that? Because the apex has a very small cross-section itself. It's hard sometimes to have levers thin enough to insert that deep, but that are also thin enough to penetrate the interface. And there we have no grip, so usually, with apices, we're forced to go in with burrs to free up the space all around the apex surface to be able to insert a burr. Now, with Blexo, I had a great experience because it was a walk in the park. You see, in the first two photos on the left, being able to rest directly on the apex and then work. Such a small and thin instrument. In percussion, always seeing it because there's no irrigation, as we said. And once it's in, these are situations where sometimes, for example, I decide, so to speak, to accept that this instrument may deform. And basically, I sacrifice it to remove the apex, to get it out. It doesn't happen every time that it deforms, but sometimes it can happen. What we just glimpsed are essentially the Blexo instruments, which, as I said, are designed very thin so as to more easily find the periodontal space, so they can penetrate very nicely. But in the Blexo line, there is another set of 4 instruments that are the ones called angle fit. Basically, these are instruments that have an angled tip so as to reach and access spots in the mouth that sometimes are a little more awkward. The angle fit too, since these are also based on the Blexo concept of extraction tips with high penetrating capacity, so they're still narrow, thin, and sharp. They can be useful, as I said. Also, these for removing apices. Obviously, they're a bit larger than the micro, and so these already have a little more trouble if the apex were really extremely small, but often when facing roots broken fairly deep below the crestal margin, they can turn out extremely useful, and these instruments have angles in every direction so that you can access all around a root or a tooth in any position. In the end, with this kind of angle, they can be useful for anterior teeth as well as posteriors, but honestly, when I designed them more for handling wisdom teeth, or anyway, molars. So much so that they ideally recall what are traditionally the levers of Friedman or the levers of Floor. This because, I repeat, there is a tip that has an angle designed to approach mesially to the tooth, the mesial side of the tooth. One has a curve for accessing distally, and there's also the version right and left. In this case, going back to the case, we started with, you see a slice here, of the arch, where there are, first of all, the first teeth. We had extracted the 12, the 11, and the 21. But then you see in this case, there was also the canine with a sharp angulation of the root. Here it married perfectly for me. The use of a Blexo angle fit, mesial, which is what was done. So I'll show you this last extraction too of the root, a first pass I did with the micro. You see that? With this, we open up some space. Then at a certain point, given there was the angulation of the root, the micro, being straight, would have hit against the bone. So it would have been useless to keep pushing because if anything, I would have damaged the bone. I put in a Blexo angle fit, which I could, so to speak, work a little more at an angle, and then the Blexo angle fit, which I could use being thicker by rotating it, doing a lever action. And so, here again, in 2 simple steps, you see how the tooth is already lifted, and at the apical end. But with the angle fit, I worked really comfortably, super comfortably. Then, once the teeth were out, the implants were placed. I'll show them now just to give an idea of the end of the clinical case, even if it's not what we care about here. And the whole plan was to do this kind of all-on-4. But what I'd like you to notice in the image on the right is how you can see nicely and well preserve the alveoli of the teeth. Now, set aside where the implants are in the lateral position, because there, the very fact implants were placed doesn't allow us to really appreciate the kind of preservation of the alveolus, but in the centrals, which instead were left empty, or rather I should only say, filled with collagen. You see how perfectly the alveolar volume was preserved without any major fractures, especially of the buccal surface, which was what I cared about preserving. What will partly resolve itself, but a complete fracture of the buccal surface, both in the case of placing the implants in the laterals, but especially there, but also of the central, would have led drastically to a loss of the whole buccal profile. The angle fit, though, for me, find their ideal use right in the posterior sectors. In this case, I had to extract an upper second molar because there was a wisdom tooth below that had caused an early resorption of some of the roots. And here, I approached it more or less as I would have with a Friedman lever, so working where I could as engagement on the lateral side, but then also and above all in the mesial area. What's the big difference versus a traditional Friedman lever? The Friedman lever, if it doesn't go in, you can only open space with a burr, whereas this kind of angle fit has the ability to penetrate more easily because it gets helped by the person providing the machine. With the magnetic mallet, we can leverage this penetrating capability and go push the insert inside the periodontal space or between teeth to facilitate the extraction more easily of the roots. The tooth started moving, so I'm grabbing the burr, and the tooth already moves a lot. It doesn't come out, doesn't give us satisfaction. You see this in real time, which I think is maybe one of the perks of being able to see an unedited procedure. The patient had pain, was given a bit more anesthesia. Real time lets us kind of really get into the situation, as if we were working right then, since the tooth was tough. He decides to go with the angle fit. See, from the palatal side, that's another perk because it's even easier to get in. True, the bayonet design of traditional instruments lets you do this simple posterior approach, but in my view, the angulation of the angle fit makes it even more versatile. The last little tap, I think we moved it even more. So, once again, we should be there now. Clearly, here is what it is. Once again, another case. Here you can't even see it. The instrument lets you work, trying to reach those positions that are very hard to reach. See what a nice penetrating capability it has once you get a bit of movement. This angle fit is the angle it's lifting with. What's nice is they can be used in spots. That would be absolutely tight. And despite the limited access with the angle fit, you can get into zones that are hard to reach. And here you see the little tooth once it's out. Wrapping up because we're getting near the end of this talk together. The Blexo instruments were designed for easier penetration inside the periodontal space, so they're thin and sharp. Being thin, though, makes them more prone to bending, so they have to be used with some care. They can't be used in a rough way, unless you accept that they might break. And the fact they're sharp means that over time, they really lose their edge. And so, like any sharp instrument, it'll more easily need to be replaced like any instrument subject to wear. Here you see one of my micros that unfortunately after a long career I had to start thinking about replacing because it really got bent. But if used carefully and for what they were designed for, they sure tend to last longer over time. Let me explain. The micro, the slim, and the arch are basically periotomes, so using them as levers inevitably leads to them bending. They're periotomes, so they must work in the periodontal space where there's collagen fibers, so soft tissue. So, if the instrument stalls, it means it's working against something that's no longer soft tissue, however, tight, but working on bone, working against the root, so cranking up the power. Above 1, max 2, is pointless, because if we keep pushing, we'll just start bending the instrument. So the instrument has to slide freely. If the periodontal doesn't slide freely, it means don't insist. Instead, maybe grab a piezo, or a luxator, or a piezo tip. As for the angle fit and the long root, on the other hand, a moderate lever action can be done, as you saw in the video. Think of using them, rotating the wrist so they can also work as an elevator. But keep in mind, they aren't as thick as the extractor 2 or the extractor 2, so this lever action too will need to be moderate. Last one, and then we wrap up. A case where the micro came back. Really useful, as many of you know, I'm a fan of autotransplants, and so I had to close this talk with an autotransplant. We're looking at a tooth that unfortunately, as you see where the arrow points, is undergoing ankylosis. This ankylosis led to a replacement of the root with bone, so there was this bone bridge that basically joined the tooth to the underlying bone and clearly blocked its exit. Now a tooth like this is doomed, but even just to buy some time, I wanted to try bringing the tooth into the arch so it was exposed, and then to cut that bone bridge. I decided to sacrifice, as I said before, a micro. That is, to use a micro to cut bone, which it wouldn't do. But I did it on purpose here, knowing that this kind of approach would lead to losing the edge or to deformation. But I needed it just to cut. Here you see the tooth. I knew where the attachment was. The bone bridge was right there. And so I started working to try and cut it. Luca, they're asking in chat, what power level you suggest for using the Blexo? Well, for me, absolutely 1. For extraction, especially. Power 1 is the one that protects us from the risk of alveolitis, what we want to avoid. For other surgeries, I may use higher power. But for me, power 1 is always the one I'd recommend. Here we have a particularly delicate instrument, and even more, so a power increase may not necessarily give a benefit in use, but it can lead to instrument wear with the long root. Instead, see here, I used some leverage. So I had already cut the bone bridge. I leveraged the ability to do a bit of leverage with the long root, transferring more deeply the fulcrum point. That was to engage the instrument. I rotated and the tooth came up. Here it was handy also to preserve the bone of the alveolus, where I'd then place the tooth. It was extracted. See where the area with ankylosis was cleaned. Then, of course, it was repositioned, temporarily fixed with orthodontics. Then, see on the right, the immediate post-op. Then we wrapped up the whole orthodontic phase. And in the end, a tooth that healed and is currently still in the patient's mouth. Plus, having been surgical in the true sense of the word. In going to act only on that small bone bridge, we saved the entire periodontal ligament of the rest of the tooth surface. So this tooth is basically fully healed with a periodontal surface that ties it to remaining bone, and we could do orthodontics on it for this reason. With this, I'm done. And thank you for your attention.